this 3-year Ontario College Advanced Diploma program, students practice primary oral health care in their roles as preventative specialists. This program emphasizes on preparing graduates to function within a collaborative relationship. Students will learn how to provide dental care with professionalism through a variety of learning experiences. Students acquire knowledge which allows them to experience the role of dental hygienists as an advocate, educator, researcher, administrator, clinician, and health promoter.
Ali, are you sure about this?
Come on, open wide.
We're live.
Oh, hey there. Welcome to Learn This.
This week, we're going to be learning about the exciting world of dental hygiene.
This 3-year program provides students with the knowledge and tools to make it in the dental industry.
We have Kennedy and Julia in the studio. They're two students who are passionate about their line of work. They're going to give us a little more insight.
They're also going to show us how to use these tools.
Wait, you were going to use those on me and you don't even know how they work?
Minor details, Jason. Besides, I saw a look at those cavities. When was the last time you've been to a dentist?
I went to the dentist last week when I got a grand tour of the Algonquin College Clinic. Let's take a look. Hey guys, I'm Jason D'Souza. I'm here at the Algonquin Dental Hygiene program where we're going to scrape a little bit deeper as to what this program's all about. The clinic is where the students get to put all of their knowledge to use. The Algonquin College Dental Clinic covers a broad range of practices, so you know that when you walk in, you will be respected as a client should. The process starts with students. Students are trained on all aspects of clinical work. For 3 semesters, they train on models and each other. They do full assessments of the oral environment, including oral cancer screenings and periodic assessments. Students are trained in professional care, in assessments, topical anesthesia, and sealments. The clinic comes with a full radiology section.
Nervous?
A little bit.
Okay, open wide.
Halfway through their second year, students begin working with patients. They'll build relationships and trust in the teeth they will be working with. Although the dentist can be a scary place for everyone, the clinic works to make sure patients are comfortable as they can be.
As you can see, we learned a lot here today, but the most important thing, no cavities.
And we're back with Kennedy Lane and Julia LaFlemme. Thanks so much for being here, guys.
No problem.
So I want to start off just by talking to you about how you got into dental hygiene. What prompted you to get into this program? Why is it a passion for you?
Personally, I had a great dentist growing up. I'm from a small town, so I knew everybody who worked at my office. My dentist, he really made it personalized care and really made it seem like it was something that was important. So I kind of wanted to bring that with me throughout my life, and now I love it, so I wouldn't change it for the world.
And for you?
And for me, it was, I had braces when I was in high school, and just seeing the change that it could make to my smile and just like what they could do, just really sparked my interest.
And how long is your program?
3 years.
And what's your favorite course in the program so far?
I liked human pathophysiology, so we learn all about different diseases, that sort of thing, and what we can treat, what we can't treat, what we need to take into consideration when we do those treatments, and anything like contraindications, stuff to avoid, that sort of thing. And clinic, of course I love clinic, because that's when we actually get to work on real clients, so that's the most enjoyable, I think.
Is clinic when you're actually working with clients or when you're practicing?
We're
working
working on clients. So pre-clinic is whenever we practice, and then clinic is whenever we got working on the public and actually cleaning their teeth and doing different procedures.
And do you guys get paid when you work in
No.
clinic, or is it just us?
We pay to do it.
For you, favorite course?
I'd say clinic because it's hands-on, and you're taking what you learn in theory and everything that you learn like in lectures and stuff and applying that to actual client-based procedures.
What's your least favorite course in the program so far?
We have a lot of community stuff. We have around 5 courses where we just learn about talking to different groups of people, and it's kind of repetitive, so that's kind of where I don't like it as much. But we definitely take what we learn from it, and we can use it a lot in clinic, which is nice. It's just one of those things that you have to do.
Do you guys have a co-op in the program, and what's that like? Have you done it yet?
We don't have a co-op. We have the clinic at the school that was viewed earlier. That's kind of our placement. So we don't actually get to go out into an office for like a long period of time. We do the clinic at school and we're in there twice a week. So right now in our third year, we have double clinics that are 6 hours, and then we have single clinics that are 3 hours. And then we also do day placements that aren't really like a placement, but like a community day, where we go to hospitals, the youth service bureaus, Ottawa Public Health, and just do like a day trip.
They have assessments of people, and at YSB we do actual cleanings, but for the most part it's just assessments and giving some oral hygiene education to them.
Okay, great. Thank you so much. I really appreciate you answering our questions. The students definitely know the most about the program. I feel like we learned a lot. We actually talked to some other students from the program and some educators, so we can take a look at that. We'll be back with Kennedy, who's going to talk to Allie about how to use the tools that she was using on my face earlier.
Brett O'Neill. I'm in the dental hygiene program last semester.
Good.
Third year. Honestly, I've always loved going to the dentist. Sounds weird, but I have. Since I was a child, I loved it. And I was looking for some kind of career that is kind of science-based, hands-on. So I looked at these programs and I saw it and I applied and off I went. Like it was a very spur-of-the-moment decision, but it turned out awesome.
My name is Caitlin Eagles. I am a third-year dental hygiene student, so I'll be graduating in April. For today, I'm doing my pain management clinic. So in Ontario, we're not actually allowed to administer local anesthetic, so the freezing, but we do practice doing it. So we have special little, we call them Dexter mouths, and we inject just blank solution into them, and it bings when we actually hit the right area. So it's really cool that we get to do that here, but we actually, when we go into the working field, we won't be doing it.
So my name is Janet Munn. I teach dental hygiene here at Algonquin College. I've been teaching for about 12 years, and the last 5 years full-time. Right now I teach local anesthetic preclinical. I teach dental hygiene theory, which they do the local anesthetic theory portion in that class. And I teach ethics and professional issues.
Welcome back. I'm here with Kennedy Lane. Thank you so much for coming in and bringing all these awesome tools to show us.
No problem.
So what exactly do you have here?
So today I brought a Typodont to show you how everything works. So this is what we kind of practice on for a bit in clinic to begin with. So it's just extra large teeth to practice on. I also brought some instruments. So we have actual instruments for assessment and instruments for the actual cleaning. So just to give you an idea of what we use every single day. And then I have a mouth guard here that we make in the clinic for the public as well.
Wow, so there's a lot of tools here on the table, and they all look so similar, but I'm guessing each one has a specific function and purpose.
It does, yeah. So we do have our assessment instruments. So today I brought an Explorer. So that's just looking at all the areas of the teeth, checking for calculus, which is hardened bacteria and food debris underneath the gums, above the gums, that we actually clean off. So that's what our main purpose is in clinic.
Oh, what happens if you let calculus build up?
So that's when you can get something called periodontal disease. So whenever you get bone loss below the gums, you start to get inflammation, pain, you can lose your teeth, that sort of thing. So that's when people don't realize how critical it is that you go get those cleanings.
Absolutely.
Yeah.
It's definitely necessary.
So part of the periodontal assessment, to make sure that nobody has periodontal disease, we have a probe as well, which is an assessment tool.
So does that have to go into the gums?
That goes right in the gums. So preferably what we want is between 0 and 3 millimeters. Anything higher than that, that's probably when you're going to feel pain when we do it, and whenever it's getting a little unhealthy. So that's what we're looking for with that as well.
Is that something you come across often in the clinic?
It is. So we're open to the public, and a lot of people we do get have periodontal disease. So whenever they're getting that gum loss, whenever there's recession down the teeth of the bone, that sort of thing, and that's when we need to really start taking care of that and enforce how important it is to take care of your teeth at home.
Absolutely. And those 6-hour clinics you were talking about with Jason earlier, right?
Yeah. Oh, yeah.
So after you have the assessment with these tools, what's next?
So that's whenever we get into the actual cleaning. So we have different tools. So we have universal curettes, which are used, let's find one. Here's one here. So this is called the Barnhart. So this tool we can use in all areas around the teeth, below the gums, above the gums, wherever you want it. But this instrument in specific is only for the back teeth. So anything from these two here all the way to your canines or eye teeth, whatever people want to call them. So those are your anterior teeth. Anything behind that is your posterior teeth. So this instrument is only for the posterior. And then we have the area-specific curettes. So they're used, just like this one, they're used only in one area. So we have the distal surfaces, which are the back of the tooth, mesial surfaces, the front of the teeth, facial and lingual, which are the gum side and the tongue side.
And how do you memorize all these? They all seem like they do something
A
so
long
different.
time. So our first whole year is focused on memorizing the tools. So that's what we do in our first year. And then we start working on clients.
Is
So,
it worth it though?
It's so worth it, yeah. It's great.
I can tell you really do seem passionate about your work.
Yeah.
So what else do you have here?
So we have sickle scalers. So those are the ones that are very sharp, very pointy, and need to be kept above the gum. So you don't want to injure anybody when you use these. So this one as well is area specific too, so you need to use it in the anterior area of the teeth, and then you can't use it in the back at all.
Yeah, I mean, that's definitely something a lot of people have the issue with when it comes to going to the dentist or visiting the dental hygienist is the pain of the fear.
Oh, the fear is a big, big thing, yeah.
So how does your team work to ease the stress of facial?
So we have stress reduction protocol, which they like us to use all the time, even if people aren't nervous. So just talking to people, telling them what you're going to do, giving them breaks if they're needed. We have pillows, that sort of thing, if people really do want them for comfort or if they have back problems, any of that. And we really want to reduce the stress that way. We're full of healthcare professionals in there. We have licensed hygienists, we have dentists, so anyone who can give them that comfort of knowing what's going on, we have that there to give them.
I did notice when I went to the clinic, it seemed like a full functioning team that really made this whole clinic run smoothly.
Yeah, we're full of people.
Yeah, absolutely. From the receptionist all the way to Tanya, who is actually cleaning the instruments. You know, it seems like a lot of work.
It is.
So tell me, how much did all this cost you?
So this is, everything we buy is included in tuition. We get 3 full trays of instruments. So altogether, we probably have around 40 to 50 instruments, and they all cost around $50 to $75 each, depending if you're getting area-specific, universal, sickle scaler, that sort of thing. That's all depending. So we spend quite a bit of money on instruments alone, so that's why tuition can get pretty high, but it's all worth it when you get all these. You can bring these home from school, so these are ours for the rest of our lives, which is nice.
That's perfect.
Yeah.
So, and thank you so much for bringing these in for us today.
Yeah, you're
one more
welcome.
quick question before we have to go. Which one's your favorite?
My favorite is, so it's a pointy one. It's a little dangerous, but I like the, if I can find it, 204S.
Oh yeah, that does look dangerous.
So it's a sickle scaler. You can use it just about anywhere, and it can take off anything.
It seems like you have a lot of tools here, all the kind of tools that help you climb the ladder of success. I wanted to say a special thank you to Kennedy and Julia, who came out today to help us learn a little bit more about your program. It's actually so interesting. There's definitely a lot that goes into it.
Yeah.
And a special thank you to the men and women at the clinic who helped bring this show to life. This concludes our episode of Learn This. Next week, we will bring you to the dramatic world of theater arts. You don't want to miss it. I'm your host, Alejandro Molina, reminding you, don't forget to floss. Have a good night, everybody.
Thank you.